Mr. President, I want to follow right along with what my good friend, the senator from Texas, is talking about. And first, I'd like to say, you know, one of the philosophies of government that I thought was so well stated in such a succinct way by Abraham Lincoln at the Cooper's Union in New York in 1860 was, he said, government should do for people only those things that people cannot better do for themselves. And there are some things in healthcare that government actually could do to then let people do things better for themselves. That's why our side, beginning in 2009 and before that, advocated things like buying across state lines, a bigger marketplace. Organize a marketplace. Don't try to operate a system. Don't try to create an environment where people can't make decisions about what they want, and somehow we think the government can make those decisions better. We all talk to people every day who had coverage, as the senator from Texas said, that they were happy with, that met their needs, and now they are told by the government, well, your new coverage is better. It doesn't matter if you don't have any children. You have pediatric dental care. Doesn't matter if you're retired and plan not to have children. You now have maternity coverage. Doesn't matter if you've always had insurance. This covers people with pre-existing conditions. The American people have figured this out, and they don't like it. You know, the system we had at the workplace-based insurance was largely a system that developed by accident after World War II. But interestingly, 85% of the people that had insurance got it at work, and 90% of them were happy with it. I think that's going to be the next thing we find out as we walk down the road, how many people are no longer going to get their insurance at work. But now we know the impact on people who generally didn't have insurance at work or have insurance the first time. I've got some stories here I want to share that people have contacted our office in the last few days and talked about, the few days since I was here a week ago, to talk about some stories I had then to tell that people are telling me. But just earlier today, another anecdotal evidence, somebody who at 27 left their family policy to get their own first insurance policy ever with the biggest insurance company in the country, went to the doctor they'd always gone to, and the doctor says, well, we don't, not the doctor, but the people, the receptionist, the people dealing with her said, we don't take that insurance here anymore. And then her request was, well, I want to see the doctor I've always seen. This is just, can I just pay cash? And the answer was, no, you can't pay cash, because we now know you have insurance. So under the new federal requirements, you can't pay cash to see the doctor you want to see. You've got to go somewhere that will take your insurance. Now, surely that's not what we all really intended to do. Those people here who voted against the bill, even those who, like me, voted for the bill, even those who, like me, spoke against it, would not have anticipated that one of the prohibitions would be that you couldn't pay cash to see the doctor you want to see because you find out that your insurance doesn't cover your doctor. This is actually a step beyond, if you like your doctor, you can keep your doctor. This goes to, if you're like your doctor, you can't even pay your doctor to see your doctor if the policies available to you didn't let you see your doctor. But, Mr. President, here are some letters I got just this week, and some email messages and some text messages, but all from Missourians. And even though I'm not going to give anybody's last name, these happen to all be Missourians that I think my staff has called and said, do you mind if we tell your story, just in case your neighbor figures out that this must be you if you're Christina from Lee's Summit, Missouri. But Christina says she's a single mother of two. She's working her way through school as a waitress, working 25 hours a week. She previously received insurance through her employer, but was not allowed to renew that plan. And now the cost of her daughter's deductible will go up from $100 a year to $2,500 a year, a 2,500% increase. As the senator from Texas says earlier, some of these deductibles for most families are like you don't have insurance at all. I don't know what Christina's situation is, but I know somewhere there's a 25-hour-a-week waitress with two kids that if they're told their deductible is $2,500, that means they really don't have any coverage, because they don't have $2,500, and they're not going to figure out how to get $2,500 and can't get insurance that makes that difference. Or Gina from Kansas City had a birth defect that eventually resulted in having to have her hip replaced and another revision to that. She has had health insurance every year of her life until this year. Her previous Blue Cross Blue Shield policies no longer available, and policies on the exchange were just too expensive. She says, at this rate, we won't be able to afford health insurance in our current situation. I want to go back to the old system. At least I know I have insurance and that I have my doctors too. My primary doctor, she says, retired due to the new health care plan. I've always had health insurance for me and my family. After 2014, I won't. Now, I wish that was an unusual letter, but it's not, and surely there've got to be people benefiting from the system. The law of averages would catch up with you. Somebody has to be having coverage they didn't have before, that maybe they couldn't get in the state high-risk pool. And by the way, we could have expanded those. That was one of the proposals I made for people who had a pre-existing condition. Nope. The biggest challenge to reality, I think, of this whole debate has been that nobody else had any other ideas, that this was the only set of ideas out there. I brought a list to the floor the other day of the 10 or 12 bills that I introduced as a House member. The biggest one was 75 pages long. One that, according to Harry Reid, Senator Reid, the majority leader, has accounted for a third of the people that went on insurance because they were able to join their family's policy. I introduced that bill in the House. It was 4.5 pages. 4.5 pages. I guess if I'd been really good at this, and that was a third of the people on, I could have come up with a bill that was about 12, 13 pages and just got everybody. We didn't need 2,700 pages of legislation. If 4.5 pages get a third of the people that are now covered. But people, here's Mitchell in Weston, Missouri, said he still has insurance. His premiums go up over $40 a month. And frankly, that's one of the best stories I've had. Somebody that still has insurance and it's $40 a month higher. But he says this is not the answer for Americans with or without health insurance. This is now a national problem. He says, my health insurance is going up only $40 a month starting in January, but that's still, but the insurance now costs $120 a week for he and his wife. Said, most of my friends' rates are going up $100 and more a week. Now, I don't know that that's a scientific survey, but that's Mitchell's view of what's happening with most of his friends. Tony's a former owner of a hardware store. When he closed his store, he wasn't able to find insurance. Tony's from West Plains, Missouri. He enrolled in the Missouri State Insurance Pool, the high-risk pool. But when it was terminated, he was told to enroll in the Federal Health Exchange. I think he's finally gotten that done. He just says it happens to cost him more than it cost him before. Remember, the high-risk pool, here's what Tony says in his letter. When national health care became available, the legislature, this would be the Missouri legislature, I think this is what happened in most states, voted to end the Missouri high-risk pool effective December 31, 2013, and sent me a letter saying I'd have to enroll in the federal program. I began on the website the first week of October and made some attempt to enroll every day through October and November. I was finally successful in assessing the policy plans available just before December 1st. Now, here's another point I want to make too, Mr. Chairman. The rollout itself has had negative consequences on the makeup of people who have insurance. Now, I think there are many reasons that young, healthy people will decide not to buy insurance. One is that it costs them relatively more than it ever has before under the law. In December, in fact, if you were in your early 20s, you were paying about a fifth of what somebody was paying for health insurance in their early 60s. But in January, you had to pay at least a third of what somebody was paying in their early 60s. And the people's insurance in their early 60s didn't go down, but people's insurance in their early 20s went up. And I just had a dad today tell me, and besides that, you tell young people that, and you can get insurance if you have a serious health care problem, because there's no prohibition if you have pre-existing conditions. So if you're a young person, your insurance, this is the most uninsured group, young, healthy people who think they're young and healthy and probably don't need insurance because they're young and healthy, who should worry about an accident. I mean, I'm a dad. I understand how you have these discussions with, well, now wait a minute, that doesn't cover all your potential problems, but still, this is the biggest uninsured group, Mr. President. And they are not signing up, and part of why they're not signing up, one of the smaller reasons, there are fundamental problems with the plan itself, but believe me, if you're wondering if you should get insurance every day, you're not going to do what Tony did. You're not going to be on the website every single day from October 1 until December 1 until you get insurance. At some point, you're going to say, well, you know, I didn't really think I needed this anyway. I'm not going to keep beating my head against the wall to sign up for something that all my friends tell me is a bad deal and for sure is a worse deal than I would have gotten in December of last year, because the law insisted that it be a worse deal for young, healthy people. And the White House said last week that the number of people signed, when they were challenged about how the number of people signing up wasn't nearly enough, they said, well, really, I think the White House spokesman said it's not the number of people, it's the mix of people that really matters. And I think the number they've had out there is about 40% of the people that sign up need to be under 35 and hopefully healthy, and that number is about 25%. So the mix isn't working, the number isn't working, the cost isn't working. According to Sean from Independence, his premiums for his private policy went up 40%. If he elected to drop his private policy and sign up on the exchange, according to him, his premiums and deductibles would more than double, and he wouldn't qualify for any subsidies. So for Sean, the best deal was the 40% increase. He had a more than 100% increase if he went to the exchange and higher deductibles. Lynn from Farmington, Missouri, says that at Mineral Area Regional Medical Center, premiums increased even more than usual due to the Affordable Care Act requirements. We have increased the employees' portion of the health insurance premium in order to increase deductibles and co-pays due to the ACA required new coverage that every plan has to include. Barbara at Fulton, Missouri, where Winston Churchill gave the famous Iron Curtain speech at Westminster College in Fulton, says her husband's Blue Cross Blue Shield plan was canceled because it was deemed, this is her quote, illegal per the Affordable Care Act. Her family, her husband and 2 daughters, is now paying more money for health insurance. My husband had insurance he liked, and when we received a letter from Blue Cross Blue Shield that his plan was going to be discontinued due to requirements of the Affordable Care Act, they were disappointed. I was also told that my 4-year-old child could apply for state Medicaid, and my 9-year-old child earned too much to qualify for insurance through healthcare.gov. They qualify for neither of these programs, she says. Because of her quote, because of Obamacare, we as a family are paying much more for health insurance for our children and my husband is not currently fully insured. And my last letter, Mr. President, is from Scott in Independence, Missouri, who says his employer dropped his retiree health plan for 2014 due to increased costs associated with ACA. I don't see here who his employer was, but we've seen big employers. IBM dropped their retiree health plan. UPS dropped their health care for all of the spouses and dependents of their employees, in both cases saying, well, now you've got somewhere to go. You need to go to the exchange rather than the plan that you had as part of being a retiree or part of being a spouse of someone who worked here. Scott looked at plans for on the exchange, and for a plan that is worse than what he had under his employer, he will pay 280% more in premiums, and his out-of-pocket expenses, I guess that means deductibles, will quadruple. 4 times the deductibles, 280% the premiums. He says essentially, let me read one other thing here. It talks about being a disabled veteran. Since I'm also a disabled veteran and exempt from the ACA, I went to see what my cost would be for a policy for just my 9-year-old daughter. Unfortunately, I can't enroll her unless I enroll, so my cost will go from $159 for a Cadillac policy to $459 per month for his description, a horrible ACA policy this year. Essentially, I was forced to buy a policy I neither want or need. It'll cost me far more and provide far less than my canceled employer plan. Bigger marketplace with more choices, more ways to ensure you can take your insurance from one place of work to another, more ways to ensure that expanded high-risk pools would let people join those high-risk pools. And by the way, if you're an insurance company and you have to participate in that in some way, at least you know that all the other insurance companies are too, and everybody in that group is somebody who had a pre-existing condition, as opposed to having to assume you're going to get less healthy people than hopefully you get. Mr. President, I just say that everybody in the country and everybody in the Congress knows more about health care than most people did 5 years ago. I think it'd be a good time for us to take all that new knowledge about health care and see if we couldn't look at this again and do a better job. And Mr. President, I yield back.